Hi there. Welcome back. Thanks a lot for staying with us here on the show. And we've got our next conversation coming up right here. And of course, tomorrow is going to be on. So watch out for Prime Time with George Quay, and I'm sure you will enjoy it. But forget about all the things they said. Yeah, they're not true. Very untrue. Anyway, let's get into it. But let me quickly remind you that Sunday 4 p.m. we're bringing you the Big Chef. Big Chef is the ultimate place you can actually learn a lot of cooking. And so please do well and tune in 4 p.m. every Sunday on Joy Prime and vote for your favorites so they can also be winners as well. All right. So that's what you need to know. Big Chef, we're cooking some really, really good foods over there. Now, we're getting to our health conversation this morning, and we're looking at Mpox. I don't know if you've heard it before. This is your first time you're hearing it. Well, if it's your first time hearing it, then you have to really open your ears and know everything about what Mpox is all about, because you will need that information to be able to either stay away from it or have a better treatment, or maybe, just maybe, spread the word to most of your friends out there who probably would not be able to, listen to this conversation. Now, Dr. Frederick Asiedu-Bekoe is here with me in the studio for us to get into that conversation here on the show. Doc, good morning. How are you doing?
Good morning. It's Franklin.
Oh, Dr. Franklin. I'm sorry. Dr. Franklin Asiedu-Bekoe. Yeah, thank you so much. I appreciate that. Now, let's talk about Mpox. A couple of weeks back, this conversation was all over the place, and then it goes off a bit, and then it comes back again when we have cases coming up and all of that. The Mpox itself is exactly what we're looking at.
Yes, thank you very much. So I think I need to state that Mpox is not a new disease. It's been on. I would say that it was first isolated way back in, I think, 1958.
Really?
Yeah. And
so it's not a new thing at all?
No. But it's new in, I would say, parts of Africa and Ghana.
Okay.
So, like, if you look at Nigeria like that, they've had Mpox for a long period of time. Ghana, until, I would say, until 2022, we had not confirmed any case. And I think I need to state that confirmed. Because if you do not look for it and test it, you may not get it.
Okay.
So, because it looks like chickenpox, it's possible the time past people had chickenpox or Mpox, and we didn't confirm it. So that was the situation. But then, the year 2022, it cuts across several countries. So WHO actually declared it as a public health emergency of international concern, meaning that it had crossed several regions, Africa, Europe, Americas. So the idea was that we need to have a global effort to address the challenge. Mm-hmm. And at that time, you see, Mpox is actually a zoonotic condition. It actually comes from an animal to man, and then you can have man to man. For the first time, we tend to have a lot of it in man to man. And there was a lot of issues about sexual orientation.
Okay.
Mpox is not actually an STI, but then because it's spread by contact. So let's say if man on man or man and woman are having sex, it's contact. So we may exchange the virus between them. So it happened particularly in a lot of Europe and Americas, and people who were having male to male, they were getting having much more issue. So until end of 2023, it went down. And then 2024, it started also in Congo DR.
Okay. And
then went to Burundi and Rwanda, and was also declared also another public health emergency of international concern. So for Ghana, we have not been having a lot of cases. 2022, we had 120. 2023, we had 8. 2024, we had 5. And then this year, we had only 1 case far back in February. So we were there. And then all of a sudden, from May to now, as I speak, we have 91 confirmed cases. So
91?
Yeah, 91. So we realized that within a short time, there's a increased spread. So I'm trying to get an understanding. What we are getting to know is that there are some areas that have had these rashes. But to them, it's like chickenpox, and nobody is dying. So what is the problem? So until a few people started getting severe disease and were admitted, That's how it came up. So that I would say that's the background of the situation in Ghana for now.
And we have 91 cases.
Yes.
These cases, do we have an idea where they are prevalent?
Yes, so if you look at we have it cut across 10 regions.
Okay.
But the dominant regions are Greater Accra, Western and Western North. But for me, I need to state that for now, it's more of a national outbreak. Do you understand? So you do not need to narrow yourself that I'm going to Greater Accra, so I'm being careful. No. You need to look at it as a disease that's occurring in the country and how best you can prevent it across the country.
I see. Interesting. Now, if someone is going through that sickness right now, what are some of the things that we would see, and based on that, we would say that this person has Mpox?
Okay, so it will start as a typical systemic disease. So you may have a fever, bodily pains, general weakness, headache.
Okay.
So those are the early stages, and then you start having the rash. So the rash will have several forms. It may start just like a patch, and then it gets bigger, it becomes like a ball, and then to burst. So you tend to have, let's say, if you are exposed to somebody who has the virus, it's actually caused by the monkeypox virus.
Okay, that is sexually transmitted, right?
No.
Oh.
As I said, it's spread by contact.
Okay, so any form of contact?
Yes, when it's close contact, you can get it.
Okay.
And I need to stress that it's not an STI.
Okay.
And it's very important.
Before people start thinking
yes,
that.
it's not an STI.
Okay.
You just get it because you cannot have sex when you're far away.
Mm-hmm.
It's by close contact.
Okay.
That's why you're getting. So it's not an STI.
Okay.
So basically, if you are exposed to somebody who has the virus, then it takes about maximum 21 days for you to get the symptoms. And as I said, to start with these rashes, and then the rashes will normally start from the face. It may go spread to the other parts of the body. But then because the rash can be similar to the chickenpox I mentioned,
okay,
or maybe the old smallpox. So what maybe the distinguished feature is that what they call the swollen lymph nodes. So which is like you have some, like those days when you get some swell, you realize that you have some swelling.
Oh yeah.
Yes. So you may have this swellings maybe at the back of your neck or below your chin or at your groin. So that's one distinguishing feature that you may see that could this be Mpox. Apart from that, it will be difficult to say that I have Mpox unless you go to the hospital and then samples are taken and go to the lab before they say you have Mpox. So basically, that is it.
So there's difference between that and chickenpox.
Yes, and let me state that if you look at our cases that we've had in Ghana, a lot of them are just mild cases. So they are just, you go there, they have their rashes and they are seen, and then they go home and they self-isolate. It's only few of them that have actually been admitted. But you wanted to find the distinguishing features. It's not so easy to see.
Okay.
So the issue is that you have a rash. Where we are now, don't assume that it's chickenpox. If you have a rash, what I would say is that go to the hospital. Then the doctors take a sample and send it to a lab to see whether you have Mpox or not.
Okay, so if you mentioned somewhere that a burst, is that where when you come to the contact that you may get it, or even when the thing is not, opened?
Yeah. So there are several forms of it. Some will have big rashes. Some will have small ones. So you can have minute secretions all over. So you cannot be sure which level. And let me state that the rashes can be within even your mouth, your mucosa, or also in your skin. So that's how come some people can have it in their rectum. So it's not only on the skin surface. So far as you have close contact with any person, then you're at risk of getting it because the skin will be opened and you may be exposed to the virus.
Okay. In terms of treatment, how are we looking at it? Is it easy for it to be treated? Or?
Yeah, so I would say that Mpox is self-limited. So you don't really do much for it to go away.
Oh.
So the issue is that some people who are, let's say, immunosuppressed, or people who have like children, pregnant women, they are more at risk of getting severe disease. That's why we normally admit them. Apart from that, the normal person doesn't have severe disease. So we treat the symptoms.
Okay.
So if you have fever, we treat. And normally we try to make sure, because your skin is open, we try to make sure that it's closed. And then you give some ointment or things like that. So basically, you are not treating anything per se unless people who have a severe form of the disease, some may have underlying superimposed bacterial infection, then in that case it may lead to other complications. Some may have encephalitis like that. But apart from that, in most cases, you don't have the severe form of disease. But globally, about 10% can die. But it varies, as I said, based on your underlying condition. Like if you look at the Ghana history, 2022, we had 124 died. But since that time, we have not had any death.
Okay, so it means that it's treatable. Now, the smallpox that you have, does it go away when you treat or things to it?
No, so it will leave you with the scars. Normally, it also depends on how big the rashes are. So you realize that even people
like we're seeing on the screens right now.
Yeah. So, but it depends on if it's bigger.
There are way bigger ones than this.
Yes. So you realize that you see the scars there, but just that it will not be protrusions, but you see the scars even.
Okay, this way.
Yes. So one of the things is that it used to be called Mpox. It used to be called monkeypox, but it was.
That's the M.
Yes, it caused a lot of stigma. So that's how we changed the name to Mpox. So until 3 years ago, it was monkeypox, but now it's Mpox.
So this can actually kill you?
Yes, as I said, based on your underlying immunity. And I mentioned that 3 categories of persons. If you are immunosuppressed, if you are a child, let's say less than 5 years, or you're pregnant. These people are the at-risk groups. But apart from that, let's say if you go to the hospital very early, and the wounds are managed well, you don't have any bacterial infection, then you are not likely to die. So it doesn't really kill, though a few people can die from it.
In terms of awareness, do people understand this? Have we been able to?
Yeah, so what we realize is that when we started getting a few cases, we could see that there was a time lag between when they had the rash and when they reported. Because a lot of people, chickenpox is more common in Ghana than Mpox. So if you have a rash and nobody is dying, you just apply some hot air and you go. So that has been a challenge. So now we started engaging the population that there's a new disease called Mpox, and people have started carrying. So what we are doing is that, you see, we projected this outbreak that normally if you have a disease unknown, then you are not going to have any record of the disease. If you start making it aware, you start getting more cases. So we expect that the number of cases to be going up.
Okay.
What we are watching for is there any delay? Are people still coming late? Then in that case, our interventions are not working. But if your interventions are working, you expect more people to be coming. Then the other issue, we want to see, are they having severity of disease? So if the people are coming early and they don't have severe disease, then clearly it means that interventions are working. It's somebody dying. So for now, I think that we don't want to scare people with the numbers. So far as we started creating the awareness, we expect all those guys who have had their rashes in the past to now come forward, and then to be able to make sure that we are managed early, and then also to find a way of preventing. And I want to state that it's a disease of close contact. So you need to avoid close contact people who have rashes. So like
any rash, if the person has any.
Yeah, for now you are not sure of the kind of rash. Do you understand? So avoid the close contact, hugging, kissing, so the disease also spreads in 2 ways. The contact is by either direct contact or indirect contact. So direct contact is when there's an actual skin to skin. Do you understand? The indirect is when you have contact with the secretions of the infected person. So let's say you are in a house, you are using the same towel. Do you understand? You are using the same sponge. You are sleeping on the same bed. Those are avenues by which you can be exposed to the virus. And we are saying that in this era of Mpox, you shouldn't allow that to happen.
So if I have a partner and the partner has it, what's the first thing that I'm supposed to do once I notice anything?
No, so far as you are concerned, the person who has the rash must go to the hospital. And then as far as possible, the person must self-isolate. If it's a severe form of the disease, the person will be admitted for some few days and this time.
Oh, okay.
But the issue is that we avoid contact with any person who is assumed not to be infected, so that you don't transmit the disease.
How do children deal with this? I'm looking at this image on the screen with a child, I'm suffering that, and I'm asking, this would be very uncomfortable for a child to deal with. Have we put in plans to it?
Yeah, so that's why it's normal. The children are admitted. The children, we don't allow them, because they can't, some of them, apart from crying, they don't know how to express pain. So for children, we make sure that they are admitted and given the necessary medication is to relieve their pain, to relieve the fever and things like that. And then their wounds are taken care of.
But the scars will still remain.
Yeah, as I said, depends on the size of the rash. People have had chickenpox, they can still see pockets of it. But with time, you realize that it will kind of flatten out.
Okay. Well, what message are we sending out to, in terms of support? I don't know how the response has been in terms of support. Are we having adequate resources to be able to take care of that? If people want to genuinely also come to support it, how are they supposed to go about it?
Yeah, so what I would say is that for now, it's an outbreak that has affected a number of regions. So we need to see it as a disease which is different from chickenpox. So we don't need to find a way of trying to suppress it. First, you need to let me put something that there's vaccination.
Oh, okay.
But the vaccination is the vaccines available are very limited. So it is not vaccines that you give to everybody. You understand? Normally, you identify the at-risk groups. So the at-risk groups are health workers or persons who have what you call the key populations, who have multiple sexual partners or men with men or those things. And then people who have been exposed. So these are the groups. So we don't want to put so much emphasis on this vaccination because globally it's limited. So what we want to say is that people should know that the disease you can get it by close contact. What we want is the message to get across. If you have the rash, go to hospital. Don't be moving around and shaking people and hugging people so that you can spread it. Everything that if the message gets across, people are restricted in the way they move about, then within a short time, we can go around this outbreak.
Okay. All right. So if you've heard about Mpox and you've not really, been able to understand it, the way it works, how you can treat it, what causes and all of that, now at least you have an idea. If you're suffering it, you know what to do, you know where to go, and how you'll be able to take care of yourself. Lastly, before we go, the stigma, what are we letting people understand in terms of the stigma? Because looking at the images, once anybody gets this, if you're not careful, people will not even want to have anything to do with you again.
Yeah, so we have psychosocial teams which are attached to the hospitals, okay, who kind of cancel the cases so that they are relieved. And as far as if you come early and then the rashes are managed, you don't seem to have any infected wounds that may make the wounds bigger, okay, or even large scars. So we try to encourage people to come early so that if you were catered for. And as I said, only few cases can become severe, let alone die. So we want people to come as early as possible so they can be managed in the hospitals.
Very well. Doc, thank you so much for joining us this morning and sharing this with us. Dr. Franklin Asiedu-Bekoe is the Director of Public Health, Ghana Health Service. He joined us this morning here to talk about Mpox. Now, it's not as scary as you're looking at it. It's dangerous, but it's not as scary because the more we get scared, the more we are not able to actually come out and let people know that, oh, this is what we're going through and all of that. Like Doc said, we're trying to manage it. So whatever it is, once you see the symptoms, just walk into don't say, oh, as for this one, I know what it is. People even know the difference between chickenpox, smallpox, and whatever it is, even when they know this one is different from what they've been experiencing over the period. So don't just make your own conclusions when you see things like that. Walk into the hospitals and speak to the doctors so that they can help you understand what exactly your situation is and take care of you. Doc, once again, we're grateful for your time this morning.